Tuesday, October 6th, and we thank you for tuning in from throughout Newfoundland and Labrador and across the country. My name is Kathy Dix-Payton, Media Relations Manager with the Department of Health and Community Services, and I will be the moderator for the question and answer session. Joining today is the Honourable John Hagee, Minister of Health and Community Services. Please stand by. Our news conference will begin shortly. Those tuning in on Twitter, we want to thank you for tuning in from Newfoundland and Labrador and across the country. My name is Kathy Dix-Payton, Media Relations Manager with the Department of Health and Community Services, and I will be the moderator for the question and answer session. Joining us today is the Honourable John Hagee, Minister of Health and Community Services. Please stand by. Our news conference will begin shortly.
Good afternoon and welcome once again. I'm flying solo. Dr. Fitzgerald will be back next week. So today I'll start as is custom by reading out the numbers. Since the public advisory from yesterday, we have no new cases of COVID-19. the total number of cases in our province is 277. We have 4 active cases currently, and we've had 4 deaths. 269 people have now recovered, and in total, we've tested 44,738 people individually. The numbers are encouraging. Obviously, it's tinged with some sadness because of passing of 4th case or 4th fatality. But overall, despite what is happening in the rest of the country, our numbers are low. As we go through day 213 and Thanksgiving approaches, I think it's important to reflect a little on that. We're 7 months, for public health anyway, into this pandemic. There's been a lot of effort made by a lot of people, staff, be they essential workers in your grocery store, your convenience store, your school, or in healthcare, have risen to the task and continued to allow life to go forward, bearing in mind the load from COVID at the time we're speaking. Labrador Grenfell Health, again, to be congratulated. They've tested over 650 people since the case up there, and I think they did 610 of those in the first 48 hours. My colleague from Lake Melville went and visited them and described them as tired but pumped. And again, I thank them. It was a community effort, though. There was a local individual who provided a tent for staff to use, and the local power company went and put up a power pole to provide lighting through the dusk and sunset hours. So everyone pulled together. All of those tests from Labrador have turned out, fortunately, to be negative. We have a small but very dedicated public health team who've been on call or working for all those 213 days, and really since Snowmageddon, because you may remember that preceded the arrival of COVID-19. They alone put in 30 hours this weekend in addition to their call to deal with queries and investigation and work related to our recent cases. But again, the people of the province, individually and collectively, have really stepped up, and those numbers, those low numbers, are a testament to the fact that people have taken to heart our messages, understood their importance, and followed sound public health guidelines and good public health measures, and hence our low numbers persist. The Conference Board of Canada have recognized the work of Newfoundland and Labrador. The Atlantic bubble is in some occasions referred to as the New Zealand of the Northern Hemisphere. And whilst those are great compliments and a testament to everybody, I think we ought to just take them with a tinge of caution, because we can't let complacency set in. If you look around the rest of the country, there are hotspots in our 4 biggest provinces, some of whom are seeing new cases at the rate of over 1,000 a day, and fatalities in significant numbers. And they struggle with their response to COVID-19. And in the case of British Columbia, for sure, they struggle with a second epidemic of opioid deaths. And that is making life for them even harder. And so when we look at what our options are, both in Newfoundland and Labrador and across the Atlantic bubble, I think we have to recognize those challenges that they face. We have to share in terms of what we can do to keep the people of this province safe and healthy. We need, as the Thanksgiving weekend approaches, to continue to use good public health measures. We need to be vigilant. We need to use physical distancing where possible. And in those circumstances where it's not, then the mask is your friend. If you move, you mask. If you are in a situation, and certainly in public areas indoors, where physical distancing cannot be maintained, you must wear a mask. The order is clear for those common areas. Everybody that I have come across in buildings like Confederation Building or going down to the local store in Gander, by and large, people have taken these messages to heart. But there is a temptation to pat ourselves on the back and maybe relax a little. But you've seen what's happened in other jurisdictions when they've relaxed too much and too soon. The masks are an added layer of protection, and the views on these have changed over the course of the 6 or 7 months, and it's now clear that a non-medical mask is an added layer of protection. So as the holiday approaches, I would like to wish everyone a joyous Thanksgiving, a time with family, particularly at this time of the year, and I hope everyone does get a little bit of a break before the week resumes. It'll come fast enough. So from my family to yours, happy Thanksgiving. Hold the line, Newfoundland and Labrador, however, we do need to keep an eye on ourselves and what's going on elsewhere. So I think with that, Kathy, I'll pause there and be prepared to try and answer any questions the media may have.
Thank you, Minister. For your benefit, we have 4 reporters registered for today's call. We will conduct the question and answer session in 2 rounds, where each reporter will have the opportunity to ask 1 question and 1 follow-up per round. If time permits, there will be an opportunity for further questions. We suggest that you not ask rumor-based questions. The purpose of these briefings is to address COVID-19 issues. All other government-related issues should be directed to the appropriate department or agency for response. Reporters will ask questions in the order they registered for today's call. Our first questions are from Peter Cowan of CBC News. Please go ahead.
Mr. Haggie, we've seen other provinces have put out very specific guidelines when it comes to who you should be seeing or not seeing this Thanksgiving weekend. What's the advice in Newfoundland and Labrador?
That's a very good question. Thanksgiving traditionally is a time for family. Families in Newfoundland and Labrador can be quite large. I would suggest that you keep it at a family gathering, particularly bearing in mind if you have elderly relatives or family members who are immunocompromised, that these people are particularly vulnerable, and it would be important to make sure that the people who were mixing with them, you felt comfortable. We've had that matrix of people, space, time, and place, but I think it's also worth repeating that if you are not well, do not go out. If you are not well, do not host. And I think if everybody follows those simple guidelines, I think we can keep our risk as low as we can. There is no risk-free scenario here. There's just one that risk is managed and you collectively and individually feel comfortable with.
When you contrast that advice with other places like parts of Ontario, for example, where they're saying don't interact with anyone outside of even your own household, never mind bubbles, what do you think it says that after months of our restrictions here generally being more stringent than other provinces, we're now at the point where people here may have more opportunities to interact with their family this Thanksgiving than some of those places that are seeing those 1,000 cases that you were talking about earlier?
No, and I think that's a very interesting observation. We do find ourselves relatively fortunate by comparison, but we do so because of the strictness of those measures that you referenced, and the fact we have maintained them in a significant degree in a way that maybe other jurisdictions have not. So that's the paradox of good public health, is you get what you've got by being firm and well-disciplined, and I think it's a testament to the people of this province that they have done so. You relax it beyond a certain point at your own peril.
Our next questions are from Jody Cook of NTV News. Please go ahead.
Thank you, Minister. Just picking up on the Thanksgiving weekend, you talk about masks, and you mentioned if you move, you mask, particularly for families who are in the same bubble. What kind of guidance do you have specifically with masks this weekend and associating with people over Thanksgiving?
No, and I mean, that, again, is a management of risk issue. If your group at Thanksgiving are bubbles or households with whom you have been regularly interacting over the last little while because of the relative security of being able to do so, then really I don't see much in the way of a challenge. Again, the important thing is that people have to be honest with their family and with themselves if they're not feeling well. There is a great tendency, and we've all done it, to dismiss a runny nose or a headache or feeling under the weather because you've built up a sense of anticipation for the event at the weekend. But the facts of the case are, in those circumstances, going or hosting an event can be unwise. In terms of masks, certainly when people are eating within their usual bubbles, I don't think there's any need to require that. But I think if you are indoors and you have strangers in the house, that's something that should seriously be considered. But I would even take that one step further. Should those individuals stay for protracted periods of time, that's a risk calculation you have to make.
Thank you. My next question, I'd like to ask about the nuances of essential workers, and this sort of piggybacks on to what was going on in Labrador last week. What exactly, and this is broad, qualifies as an essential worker? And I just want to look at something even specific like dentists. We know that typically fly-in dentists have happened in northern regions, but is it necessary in a town that's already being served by a larger clinic or multiple providers? So can you just offer us some info on the nuances of that?
Essential workers are deemed so by their employer. And in the case of fee-for-service or private contractors in the healthcare field, the regional health authority. They are the ones who would initiate the process of applying for an exemption. We do not or have not second-guessed those in any great way up to now. We've certainly, in the light of recent developments, gone back and asked the health authorities, the VPs medical, if they feel an essential worker is truly essential. What have they done to utilize people from Newfoundland and Labrador or from within the Atlantic bubble as their first choice? By and large, 75% of Labrador Grenfell's locums, for example, are already from Newfoundland and Labrador. And of the remaining 25%, anything from 12 to 20% come from within the Atlantic bubble. So there's a very small group left that actually come from outside the bubble. And we've asked them that, they seriously discuss what their options are to see if those folk are actually necessary for service delivery. Or in the case of, for example, the discussion with St. Louis today and last night with the community was whether or not the community would accept a slightly different level of service to avoid having someone in that category come at all. So those are the kind of nuances around healthcare essential workers that need to be managed at an operational level, almost on a day-to-day basis sometimes.
Our next questions are from Richard Duggan of VOCM News. Please go ahead.
Thank you, Minister. Public Health has said last week that they would be investigating the circumstances surrounding that case up in Labrador to see if there would be any repercussions. Just wondering if you could provide an update on that investigation.
Yes, that's a very good question. Certainly, there is an investigation ongoing. It is not quite yet complete. Once it is, we'll be in a position to see what options are available. As I've said before, if people are aware of the rules and choose not to follow them, there will be consequences.
And over the last couple of days, with the number of travel-related cases that we've seen a number of travel advisories come down. I was just wondering how many people, if we've seen a big spike in people coming forward as a result of those travel advisories.
Certainly from the testing point of view, over the course of the last week, we have seen an increase in numbers. Part of this is due to schools resuming. We see kind of a Monday bump usually in the incidence of calls to 811 discussions around testing. The issue specific to those flights, I don't have the numbers. I can certainly go back and find out. I think it's worth commenting in that context, though, that in terms of advisories, we are one of a very few jurisdictions that actually do provide specific flight details. Indeed, I think up until this week, we may have been the only one. I noticed New Brunswick has started doing it. Other jurisdictions, by and large, have directed inquiries to the Public Health Agency of Canada website. And I think I'd just like to put that out there because there was some discussion around whether or not we were perhaps providing enough information for travelers. And I'd like to reassure them that, once again, in many aspects of public health, the Public Health Department in Newfoundland and Labrador is actually setting the trend for the rest of the country.
Our next questions are from Peter Jackson of the Telegram. Please go ahead.
Good afternoon. The case of the gentleman on the West Coast who died the day after, the fact that you're including that now in the COVID-19 death tally would suggest that he did die of COVID-19, but I'm wondering what the protocol is for reporting whether a death is from COVID-19 or related to COVID-19, because there's certainly been some confusion as to whether that person who died a day later was actually a result of COVID-19.
Certainly, that's a very good question, and it's somewhat slightly academic in the sense of how to answer that. But effectively, all patients who have passed away with a COVID-positive test are included in our number of fatalities.
Okay. All right. That person was apparently not a resident. I'm not sure whether, have you issued any information as to what the basis for the travel exemption was in that case?
This couple were traveling to move in with their family, who are residents of the province.
Thank you.
Now for round two, and we'll go back to Peter Cowan of CBC News. Please go ahead.
Minister, you mentioned the St. Louis situation there. What's your reaction to the fact that the council there has voted to not allow a nurse in from Ontario?
I think that's a perfectly good example of vigorous, well-done communication and community input. The issue Lab Grenfell are now discussing with them is whether or not they can identify someone from within the bubble or within the province who could provide that service. That is a decision that St. Louis have made from a risk management point of view. They have personnel to provide daytime service. They have access to 811 and a nurse practitioner should they need it. And they have an ambulance in the community. And the next nearest 24-hour service from a healthcare point of view is 30 minutes away by vehicle.
You mentioned the Labrador testing numbers, 650 people tested. All of them were negative. We saw when this case was first announced, there were a lot of concerns from people who were concerned that this disease was going to spread, that more cases were going to come up. What do you attribute to the fact that even though this person was sick, was out in the community, but no one else caught the disease?
Well, I think it's a testament to lots of little things. We've said before here there's no magic bullet or secret sauce to this. Our defense is defense in layers. It's physical distancing. It's masking when indoors and when physical distancing is not possible. Those are extremely important preventative measures. It's good sneeze and cough etiquette and hygiene. And then on the other end, it's prompt identification of a positive case, prompt isolation, and good contact tracing. We are extremely good, particularly in Labrador, at contact tracing. Our metrics are among the best in Canada in terms of the number of contacts identified and the speed with which they're identifiable. Our metrics are around 90% of contacts being identified and traced and tested within 48 hours. The rest of the country, their metric is between 60 and 80%, and there are some jurisdictions that can't even make 50% currently because of their challenges. So it's lots of little things rather than one magic bullet or secret sauce.
Thank you.
Our next questions are from Jody Cook of NTV News. Please go ahead.
Thank you. Minister, last Thursday you had indicated there had been roughly 10% uptake on the COVID app. That I tweeted that out. It got quite a bit of attention by healthcare professionals in this province who are really, again, encouraging people to download the app. Has there been any increase in that, or that you have handy in front of you there that you can report on?
I don't have a number. I can certainly get the global number because of the privacy concerns. This uptake, this downloading is reported nationally only. The COVID Alert app is a very important, useful adjunct to the contact tracing I've just talked about. To be truly effective, you need to have it on your phone 14 days before you're exposed to COVID-19. That's when it works the most efficiently, and that's the length of time it stores data for, and the reason for that is related to the incubation period of the virus. I have it on my phone. I'm checking with my colleagues in the House to make sure that they are. The member from Lake Melville has just given me a thumbs up from the corner, and these are important tools. It is totally safe. It's been vetted. It's been approved by every privacy commissioner in Canada. And I would encourage anyone who has a smartphone to get it. You can get it from the Apple Store or from Google Play. And it just sits there and mine periodically beeps and tells me I've not been notified of any exposure.
I never thought I'd ask a question about Donald Trump in one of these briefings, but I kind of have to because everyone here obviously is talking about this. As the health minister, you're listening to his messaging. It goes completely against everything that we have been talking about here in Newfoundland and Labrador. Do you have concerns that the general public or population may lean towards what he's saying and disregard some of the guidance that we've been getting here, not just in this province, but in Canada?
I wish anybody who's ill a speedy recovery and back to the best of health. I would think, given my conversations with my constituents, the vast majority of Newfoundlanders and Labradorians are perfectly able to make a very sensible, informed decision about the value of that gentleman's comments.
Our next questions are from Richard Duggan of VOCM News. Please go ahead.
Dr. Haggie, the Department of Health is aiming for a high uptake for flu vaccines this year. They're planning on going into long-term care, homes, and schools. I was wondering if you could provide an update on the government's preparations to roll that out, and when can we expect more information?
Certainly. I have seen schedules of clinics from at least half of the regional health authorities. The go-live date for public clinics, drive-throughs or arena-style things is October the 21st. We were discussing with staff today and yesterday about the strategy in terms of publicizing just the kind of information you have referred to. I would expect that to be on the airwaves or in the media by the middle of next week. As I say, the go-live date for the general public is the 21st. We have bought enough vaccine for everybody. We have bought enough high-dose vaccine for everyone over the age of 65. And we are looking to 85% uptake.
And school has been opened up for just about a month now. Have we seen any sort of a significant increase in the number of children being tested for the virus?
Yes, we have seen an increase. As I alluded to earlier on, we kind of have the Monday bump in calls. Not every call results in a recommendation for a test, but there has been an increase in the number of children tested since we opened that up to children and school resumed.
Our next questions are from Peter Jackson of The Telegram. Please go ahead.
Hi, I'd like to revisit Labrador briefly. That is, I understand that the health authority there stated there was communication breakdown, but despite this being an ongoing investigation, I just want to clarify that anyone coming in as an essential worker would be given explicit instructions at the airport. Is that not the case?
they actually get explicit instructions before they get to the airport. Their travel exemption, which they have to have in hand to get into the province at a point of entry, contains information specific to their situation about what we require them to do with regards to COVID-19. They have that and should have read that before they even get on the plane or the ferry. And that is a document they have to produce at the point of entry to gain access to the province. In addition to that, and I have verified now that this is the case with all 4 regional health authorities, there is a written protocol for the individual and for their manager or supervisor to orientate them to what the health authority may require in addition. Because obviously, depending on the nature of the work of an essential healthcare employee, there may be additional measures the Infection and Prevention Control Committee in that region have recommended that would then layer on top of the details in the exemption order. The information is there. They have it before they arrive. They're expected to have read it.
Thank you. And the other question I have is about masks. We've just recently received a communication from the Autism Society and the Disability Society. There are a number, whether it's open to abuse or not, of people who cannot handle a mask in public places. How are businesses advised about enforcing this? Because obviously it's impossible in a lot of cases for a business to even know what the circumstances are.
I would suggest compassion and courtesy would be the 2 words I would start with. It is a difficult situation for some individuals. There are some who have some face shields which are approved, which they can use, and they're transparent as an alternative. For those people who truly cannot, for whatever reason, wear a mask, then there is the option not to do so. I think the challenge there is on the rest of us as to how to deal with those individuals in a compassionate and courteous way. There is no script or playbook for that. And Newfoundlanders and Labradorians have a history of treating their fellow men and women kindly. I think if there is a suspicion or a concern on behalf of the business owner that this is not the case, then the business owner does have the ability to question the person and ask for an explanation. But at the end of the day, the mask requirement is there in the special measures order, but we do acknowledge there are some individuals for whom that may not be possible to comply for reasons of disability or for reasons of health.
Thank you.
Peter Cowan, do you have any further questions?
I'm good, thank you.
Thank you. Jody Cook?
No, thanks.
Richard Duggan?
No, thank you.
Peter Jackson?
I'm the spoiler, I'm sorry. I just wanted to ask a question about PPE. There's a recent report on frontline health workers commissioned by the National Nurses Federation. And one of the recommendations on PPE, which is a big problem at the beginning, I'm just wondering if the government has made any gains at all in reestablishing a PPE stockpile, and will it report regularly if that's the case?
Yeah, we have a system now of inventory control. It's not a warehouse where you go and park the stuff and then come back 10 years later and realize it's all gone off. This is inventory control. It's kind of like a long warehouse. The new stuff comes in one end and the older stuff goes out the other. We're aiming for a 180-day supply at pandemic burn rate. We're 70% there. We're pleased with the progress and we look forward to getting to 100%.
Thank you.
You're welcome.
Thank you very much. Minister, do you have any final comments?
No, again, just to repeat, it is a family kind of holiday coming up. I wish everybody a peaceful Thanksgiving, and it is an opportunity just to have a quiet moment to think about some of the good things we've been able to achieve in the face of such adversity over the last 7 months. So thank you.
Thank you very much, everyone, for tuning in. Have a great evening.